Greetings, New Zealand naturopath Eric Backer, author of Candida Crusher and formulator of the CanXida range of Candida dietary supplements. You can find that at CanXida, that's with an X, CanXida.com. Another case presentation, interesting one here. We've got a 22-year-old lady called Jill, and Jill presented with endometriosis, a shocking condition. I'm going to talk a little bit about from my book and then sort of give you some explanation about the case. I first saw Jill when she was about 3 years of age. Her mother brought her in with eczema, an itchy skin condition. Jill was breastfed for about a week, and her mother was too tired and stressed with her other younger children to breastfeed and placed Jill on a cow's milk formula. Jill had already been prescribed a few rounds of broad-spectrum antibiotics by the time she was 3. She presented with dark circles under her eyes, was lethargic, and had multiple skin lesions up her arms and on her torso and legs, and they were scratched raw. We successfully treated her skin complaints with diet change and special probiotic. I saw Jill when she was 15 years of age, but this time she had post-viral fatigue. It would have been Epstein Barr virus. Jill was very tired and complained of headaches and falling asleep at school. Her mum had taken her to the doctor, where she received more antibiotics. All to no avail. She had menstrual cramps and breakouts of vaginal yeast infections at this stage. I then saw Jill last year when she was 21. This time she presented with endometriosis, which her doctor had diagnosed the year before. Jill had come to me concerned about her fertility, as she'd just become engaged and she was getting regular urinary tract infections as well. She had undergone surgery to remove several cysts and had experienced low-grade pelvic pain since. This time we placed Jill on the Candida Crusher program, and the results have been fantastic. We've had no more bowel problems or urinary problems. Now, there's a million Jills out there. If you've got endo or endometriosis and you're a lady watching this right now, I want you to sit back and listen. Did you have vaginal yeast infections prior to having endometriosis? Did you use diflucan or fluconazole? Did you use applicators like Canesten? Did you use any creams or products from the pharmacy to sort of cure this product? You've probably driven the condition back in the vaginal area into the endometrium. It's not uncommon. It happens all the time. Endometriosis is an inflammation of the lining of the endometrium, and it usually comes from some kind of irritant inside there. There are different theories on endo. Some people call it the retrograde menstruation theory, where they think menstrual fluid's gone back through the cervix internally and caused it. Other people call it an autoimmune condition. I call it a yeast infection gone wrong, or a bacterial infection like bacterial vaginosis, or which is even more common than Candida. But conditions of endo often have had an origin with Candida paralopsis or Candida albicans or another Candida species that's basically got caught in the endometrium, and the immune system has started to go crazy and haywire and started to really develop inflammation internally. So take heed. If you've got thrush, you need to nail this thrush. You need to crush the thrush, okay? You get rid of this damn thing. Get rid of it. Don't use applicators. Don't go and fall for the doctor's line that you'll go on an antifungal drug. It's crap. It doesn't work. I've treated too many women out there who've used these drugs recurrently, okay, and it's come at a cost. I've seen many women with infertility, many women over the years that had vaginal thrush, and they never really got rid of it. If you get recurring urinary tract infections, you need to get your immune system strong, okay? No booze, no smoking, no refined carbohydrates or crab food, drinking plenty of water. Your immune system needs to be made strong. Immune system weakness often occurs with stress. I see stress quite commonly occurring in 21-year-old girls like this because they're living away from mum and dad, they're flatting, or they've got a mortgage or a new career or a boyfriend or something. There's some kind of stress underpinning it. It usually is. If you dig deep, you'll always find something. So what am I trying to say here? I'm trying to say that you need to look at the causes of conditions like endo. Now, if you look at Jill's case here, it all started with antibiotics. When she was 3, when she was 15, she just kept getting drugs. It didn't work. Don't go down that pathway, all right? Change your diet, change your lifestyle, take a good antifungal product. Check out my CanXida.com, CanXida. It's a product I made, I'm very proud of. It's helped thousands of people. It's helped many people like Jill to beat this vaginal thrush thing. Check out Chapter 5 of Candida Crusher. It's a chapter I wrote for people just like you if you've got vaginal problems. Thanks for checking out my video.